Good afternoon, everyone. Thank you very much for joining us for this government press briefing on this Friday afternoon. We begin with a prayer from Pastor Steve Brady from the First Baptist Church.
And all by wearing this particular t-shirt, Go the Extra Mile. And I want to thank you indeed for so many of you going far more than just the extra mile over these difficult and challenging days. And now a verse of scripture from the book of Nahum. The Lord is good, a stronghold in the day of trouble, and he cares for those who trust in him. And now a prayer. Lord, we thank you for your unfailing mercies, for those mercies that are new every morning. And we come to you in our weakness and in our need of wisdom and strength for the journey ahead. And I pray, Lord, for our government, for our governor, and for our premier, and for our ministers of state, and for our MLAs, and for all who serve us so well through the civil service, etc., that your good hand would be upon them, and that you may distill to us at this particular day of trouble the grace and the wisdom, the insight that we need, so that we may make wise and God-honoring decisions before you, our God and our Father, we pray. So hear us. In the name of the Lord Jesus, we ask these mercies. Amen.
Thank you very much, Pastor Brady. So joining us today in our studio, we have the Deputy Governor, the Honourable Franz Manderson, Premier Wayne Panton, and Minister for Health, Sabrina Turner, as well as the Minister of Tourism, the Honourable Kenneth Bryan. We're practicing social distancing in the studio today, so you'll only see 3 people on the panel at any one time. Also in the studio are a number of senior civil servants and some journalists, and we also have journalists joining us on Zoom as well. So I believe we're going to go now to the Chief Medical Officer, Dr. John Lee, to get the latest update on COVID-19 in the Cayman Islands. Dr. Lee.
Thank you, Simon. Good afternoon, everyone. As of 8 a.m. Friday, the 22nd October, there have been 574 PCR tests done for SARS-CoV-2 since the last report yesterday. Of these, there are 4 positive travellers who tested positive on exit from quarantine and 30 positive tests from the community, which include 11 children. Both of the admissions to hospital remain in a stable condition, and neither of them are requiring breathing support. There have been 111,772 vaccinations given, of which 56,106 are first doses, and that represents 79% of our estimated population of 71,106. 53,813 people have completed the 2-dose course, and that is 76% of our estimated population. 1,853 people, which is 10% of those aged over 50, have had a 3rd or booster dose. I'm often asked the question, what is living with COVID like? This is it. So I very much appreciate people wearing masks and distancing, following hand hygiene requirements or recommendations, and taking care of those who are vulnerable and elderly. That is what we need to continue to do in order to protect the spread of COVID-19 disease, in addition to the very important aspects of getting vaccinated. The vaccination does not work, as we know, 100%, so it leaves a fraction of people, a fraction of all the people who have been vaccinated, to be vulnerable. So that really means that the more added people we can get vaccinated, the bigger the community-wide protection. And the deeper that penetration in all of the age groups, the better that protection will be. In particular, we're really looking to the younger people who are, in fact, the most mobile people and the people who mix most, who go out enjoying lives, and that's absolutely right. That's what you should be doing. But it's those people in particular we would ask to please come forward if you haven't been vaccinated, or to come forward to complete your course. Now we have a booster program rolling out, so we're really delighted that that is happening. It's open to anybody that's over 50, that works in healthcare, or who suffers or who's in a category of severely at risk from COVID-19 disease. I'm pleased to say that I took my booster today, along with Honourable Premier, Governor, and a few other people. So I have joined the cohort now, feeling that extra protection from the booster. We've seen in the news that immunoglobulin levels, which is one of the measures of protection against COVID-19 disease, drop off as you move away from having had that second dose of vaccine, which is why it's incredibly important that we should come forward to take that third dose or booster dose in order to strengthen that immunity. And it really does boost you up well in order to protect us from COVID, particularly as we're looking forward to opening the borders. I mentioned in a press release, but not all of you will have heard, that all of the people over the last month that have had enough viral load in order that we could put that through the genomic sequencer have shown that they all have the Delta virus, which we know is the much more infectious variant of this disease. Thank you, Simon.
Thank you very much, Dr. Lee. And I should add, we also airing this broadcast on Radio Cayman as well as on our YouTube channel and CIG TV. So I'm going to turn now to the Honourable Premier, Mr. Wayne Panton, for an update from the panel.
Thank you very much, Simon, and good afternoon to everyone. Thank you for joining us today. The whole country has been waiting with bated breath for an announcement on the reopening. I want to get straight to the point, but just before I do that, let me say that any recent discussions we've had have absolutely nothing to do with verifying raccoons. As promised in last week's briefing, we are here today to announce the transition into Phase 4, which we have agreed will be Saturday, November 20th. At Phase 4, we are removing quarantine requirements for most vaccinated travelers. While we've had some visitors during the recent months, our tourism partners have always made it very clear that the real economic turnaround will come with the removal of quarantine for vaccinated travelers. This now gives us the opportunity as a country to rebuild our reputation, rebuild our world-class tourism destination, and get many families and businesses back to work. As a community, we must acknowledge the pain, the hardship, and sacrifice so many businesses and individuals in our community have faced since last year. I know personally that it has not been easy for hardworking, dedicated, committed, proud Caymanians who have built businesses and careers in tourism, who have to rely on government assistance. We want to get you back to living your lives with independence, doing what you love, and being successful at it. I know that COVID-19 has divided our community. On many things COVID-19 related, we recognize that there are definitive lines drawn in the sand, one of which is reopening the country. The reality, ladies and gentlemen, for those who are nervous, who are concerned about it, is we are already living with COVID-19 in our midst. As Dr. Lee has noted, we have community transmission. It's not going away. In the past, we have noted this is where we would be when we move forward with any kind of reopening. It just happened a little sooner than anticipated. It's also true that with reopening comes increased travel, both by our own people and by tourists coming in and out, going in and out. And this obviously creates an increased risk of community transmission and hospitalizations. While we are committed to the reduction of restrictions to facilitate reopening, we have to protect our healthcare and education systems for the sake of those who are medically vulnerable, as well as our teachers and students. Through safety measures, collective responsibility, our vaccination rate, and preparedness of our health sector, we can support businesses in reopening and unlocking our economy. While the reopening date has been now officially announced this afternoon, we are continuing to work with public sector members, civic sector members, and the private sector to review, refine the operation and logistics of our reopening plan so that we have it properly tuned and properly calibrated to provide the greatest degree of success and safety. My elected government colleagues and I, along with the Deputy Governor and the Program Board, had a productive meeting last night with a wide cross-section of the private and civic sector members. The Deputy Governor and his team provided stakeholders a very good overview of the plan, and I am very grateful that he's able to join us today for this briefing to provide further details in just a bit. As the Deputy Governor shared last night, it is our responsibility as a government to consider the best and worst case scenarios and then make informed, calculated decisions which balance the needs of the society and the needs of the economy. We must all take responsibility for ensuring the continued safety of the elderly and vulnerable and our children who are not yet able to get vaccinated. We must not allow situations to develop that would overwhelm the local healthcare system. Equally, we must not allow the situations to develop that overwhelm our education system, because like healthcare workers, we know that teachers are a very critical part of our society. If there's uncontrolled community transmission, our schools cannot function. There is a ripple effect created by school closures, impacting students, parents, businesses, productivity, and yes, very much so mental health. For those who have been keeping track of our commitments, as promised, we promised, I should say, we would reopen the borders when we reached 80% of a vaccination rate of our population. Today, as Dr. Lee noted, we stand at 79% being vaccinated. 79%, folks. Remember back over the past weeks and months when there were those who said we couldn't achieve it. Well, we are on the cusp of achieving that, and it will be to the benefit of this country. 79%, folks, means that we are at 779 people to meet the target. And I am confident that we will be at the 80% by November 20th. Now, COVID-19 will be with us for the foreseeable future. But we know there's no better time than now to continue with our reopening plan. I've said many times before, we have looked at this issue in every which way, and we don't see that there is a better time going forward to do this. So this is our time. This is the moment that the country will go forward and succeed. We've all heard the comments and read comments about the world has moved on and we just need to open up and COVID is a thing of the past. Well, let me reiterate. The approach we're taking is a strong, sensible, pragmatic, safe approach. Getting the balance right of reducing prevention measures and protecting the population is challenging for even the most advanced countries and sophisticated countries. Some people criticize me and the government for worrying too much or preparing for a worst-case scenario when it's not necessary. But our guiding principles, ladies and gentlemen, will remain the same, and that is safeguarding the health of our community, protecting our health services, and being guided by the best data and science. In closing, we now have a date, you now have the date, Saturday, November 20th. We will continue to interact with and liaise with the private and civic sector stakeholders for the finalization of the details required for the operational and logistical side of implementing the reopening plan. There has been a dedicated team of well-qualified and highly experienced individuals working day in and day out on this. I can attest to that, having spent many of those days and nights with them. To my colleagues and the incredible teams of so many government entities, the civil service, the core civil service, the broader public service, I want to say directly to you, thank you very much. We know that you have been fully engaged and you've sacrificed a lot of your personal life in the last year and a half, and even more recently. And you've been doing this while still taking care of others at work and at your own homes. So you are truly appreciated for your dedication. And to the wider community, thank you for months of cooperation and commitment to keeping ourselves and each other safe. I know that this has been hard, but now, ladies and gentlemen, is not the time for us to give up. Now is the time for us to come together to reinforce our commitment to going forward and succeeding, continuing to care about each other, continuing to share that collective responsibility, so that we come together as one Cayman and embrace the reopening of our country as an opportunity for a fresh start in this new environment going forward. However, as I said, this is going to require cooperation. There'll be corporate responsibility, there will be personal responsibility, and a sense of collective responsibility. We are moving forward with a safe and sustained reopening that protects our healthcare and education systems and gives us the best possible chance of success. I want to thank you very much for you taking the time today to tune in, and I want to encourage you all to be responsible for your own health and safety. As I've said many times, please consider getting vaccinated. And as Dr. T noted, I got my booster this morning along with other colleagues and himself and His Excellency the Governor. Please go out and get yours as well. Thank you very much, and over to you, Deputy Governor.
Thank you, Premier, and good afternoon, everyone. I have been a civil servant for 39 years. I've been Deputy Governor for 9 years. It is a privilege to be a public servant and a civil servant. But I don't think I've ever had a challenge that we laid on us as a civil service, as a public service, that the one that the government has given us, in that they have asked us to do collaboratively, work together, and deliver a plan, a reopening plan, that allows our country to reopen safely, not have to shut down again. In other words, we're looking to achieve something that no other country in the world has been able to achieve, or very few countries in the world have been able to achieve. But this is Cayman. We have overcome so much. We have achieved so much together. If there is a country in the world that can achieve that, it is us. Why? Because we have a strong and stable government who cares about its people. We have a committed civil service and wider public service. We have an excellent private sector who is second to none in what they do, and the backbone of our society, the ladies and gentlemen of the Cayman Islands, both young and old, who are very special people, who have overcome so much in their times. From the days of mosquitoes to the days of today, having to live with COVID. But we have always achieved and we have always overcome. So I have no doubt that together, and I do mean together, we can achieve something very special. So I want to give a very high-level view of our reopening plan. It is named the Cayman Islands COVID-19 Critical Preparedness, Readiness and Response Plan. The government was very clear in what it wants to achieve, and our statement of intent said that we should safely and responsibly reopen the country to vaccinated travelers without requiring isolation upon arrival. To safely and responsibly reopen the country. To allow the country to remain open while minimizing the number of hospitalizations and COVID-19 related deaths. We want to remain open. We don't want to ever shut down again. We have all been through it. It is not good. But we have basically achieved living here for the last 18 months and keeping COVID out, but it's now here. So we're going to have to transition to living with COVID. As Dr. Lee said, we're doing it right now. To balance the country's socio-economic needs, which is so very important, and key to work collaboratively and transparently with the public service and other key stakeholders to advance our critical preparedness, readiness, and response plan, and to instill public confidence in the government's ability to keep our country safe. I just wanted to focus on two words there, collaboratively and transparently. Premier said it very early on. What we're doing should not be a secret to our people. It is the country's reopening plan, so they need to have access to the plan and to see every component of the plan. And that is the aim of the government, and we will deliver that. So moving on to the purpose of the plan is to establish what readiness looks like. So the government didn't say to us, are we ready? And we said yes. And they said, okay, let's open. They have now asked us correctly to prove that we're ready. Prove to the government and prove to the people of the Cayman Islands that you're ready. That's how you build confidence, and that's transparency. So to establish what readiness looks like, we have key categories, readiness indicators, and conditions of satisfaction that must be met in order for the Cayman Islands to be in a state of readiness to transition to phase 4 of the reopening plan. The aim is to transition in a manner that minimizes the number of hospitalizations and deaths. So we are looking to build and have almost completed our readiness indicators and conditions of satisfaction that must be met for us to reopen. To identify the gaps. So if you tell us that these 10 things need to be present in order to open, what are there any gaps? Have you been able to do that? Identification of any key gaps between where we need to go and where we are now. So where we need to go and where we are now. To enable us to identify actions, we will take the actions that we will take to fill the gaps identified and the time frames within which the actions will be taken to ensure we are in a state of readiness by the target date for transitioning to phase 4. To ensure relevant agencies are properly equipped with resources and protocols for the management of their COVID-19 related responsibilities. And that is absolutely critical. The structure of the plan. So the plan will contain key categories. These are broad areas of focus whose state of readiness is considered critical for the Cayman Islands to successfully transition to phase 4. They include a title and description. We have readiness indicators. These are individual components of each broad category for which conditions of satisfaction are set. And then we have the conditions of satisfaction, and these are a list of conditions of standards set for each readiness indicator, which must be met in order for that indicator to be in a state of readiness. So we have a RAG rating, a red, amber, green. Required actions. These are a list of actions required to close any gaps in existing arrangements in order to achieve each condition of satisfaction. So lots of detail that the government is saying to us, we want you in collaboration with key stakeholders, with the private sector, the public sector, drill down and get into detail so that nothing is missed and that we are able to achieve reopening safely. So just to give the very high level of the key categories, so we have our healthcare systems, which of course is absolutely paramount, our public health services, the Cayman Islands National Framework for Critical Preparedness and Response Actions for COVID-19 cases, continuity of essential services. We can't have a situation where our essential services are compromised. We have to put plans in place to say, we want you to do everything possible that you do not become compromised in terms of your numbers of people that are able to perform. But if you do become compromised, what will we do? Employment and labor matters, those are absolutely critical as well. Our education institutions, have we put every conceivable policy in place to ensure the safety of our children and our teachers and everyone involved in the education? Because without teachers, there's no classes. Travel and border control, tourism, data and analytics. So we have a local team and help from the UK looking at various modeling so the government can have a very clear advice as to what we can look to expect down the road. PR and communications, which is absolutely critical if we were going to gain the confidence of the Caymanian people. So that is what we're doing at a very high level. What's next is that we are crossing our I's and dotting our T's, but more importantly, we are now engaging with the private sector, the people who are going to help us make this magic happen. We are engaging with tourism, our tourism stakeholders. So some of the questions we will ask them and help them to develop are, in a hotel, what happens if you have a COVID positive traveler? So if we do an antigen test at day 3 and they test positive, what will you do? You will have to reserve some rooms because those persons may need to stay longer. What will happen in a bed and breakfast if a person tests positive? What will happen if, what protocols do we have in place for our taxi drivers to ensure that they are safe? What sanitization protocols are we putting in place for them? What are we doing to ensure that all of the persons who interact with tourists, our hotels, water sports, all of those industries have the various protocols in place to keep them safe? So this is a lot of work. I just gave one small snapshot of one sector, but that is what the government has asked us to do, to take every precaution, to do everything possible to keep the people of the Cayman Islands safe. And we are well on our way to achieving that. I thank you.
Thank you very much, Deputy Governor Honourable Franz Manderson. We turn now to Minister for Health, the Honourable Sabrina Turner.
Good afternoon, everyone, and thank you, Simon. As we prepare for the full reopening, I am here again today to reassure you that the Ministry of Health and Wellness is ready to ensure that the transition to full reopening offers as much protection as possible for our Cayman Islands community. Now, the critical preparedness and readiness measures that we have developed has drawn from the lessons of the last 18 months, and in particular, from the last several weeks of community spread. First and foremost, we have strengthened our investment in public health, a large part of this being the critical area of staffing. As noted last week, we have already increased the staff complement to support the work of public health over a number of different areas, and this includes the swabbing, testing, manning up the flu hotline, administration duties, data inputting, registration, and contact tracing. In total, we have extended 29 temporary officers for employment, 16 of which have already commenced employment, and 3 more will start early next week. 10 others will begin shortly thereafter once onboarding has been completed. I am happy to also say that we have been able to recruit 22 Caymanians to join the new team, while 2 are persons married to Caymanians and 5 are non-Caymanians, of whom will complement the clinical side of our team. Another aspect of our critical preparedness and readiness measures is the necessity and the necessary infrastructure that we have put in place to support an escalation in community transmission. I can assure you that this government has approved, and I'm happy to say this, $1 million in funding for an ex gratia stipend to be paid out to Caymanians, permanent residents, or a person married to a Caymanian with an employment rights certificate, who were required by public health to home isolate. Now, it is important, of utmost importance, that we protect our community as much as possible from this COVID disease. However, we're also understanding that while persons are in isolation and quarantine protocols are required, that there may be some financial burdens for some of these individuals. And it is hoped that this ex gratia stipend will help to reduce the stress and worry that I know a number of families have expressed to us and that they're feeling during these times. This exercise will be handled through the office of our Deputy Premier, which is the Ministry of Border Control, and it will, this can be tapped into by way of an application. Now, to qualify for this ex gratia stipend, potential recipients must be in isolation, but as directed by public health. Persons must be a person who is in a non-traveler related isolation or quarantine. They must prove to not be receiving a salary from their employer, or if they're self-employed, must show that they're not able to work from isolation. Persons must also provide a declaration that they're not receiving vacation or holiday pay or any form of similar compensation. One must not be an existing tourism displaced worker stipend recipients. Now, applications can be submitted online by visiting www.gov.ky/coronavirus, or you can simply email stipend@gov.ky with any questions. Later on this evening, there will be a full press release in this regard that will bear additional information that also includes supporting documents for each application. Please also note that each application will be dealt with on a case-by-case basis. As alluded to earlier by our Deputy Governor, we're also using our modeling exercises, which have reassured us that we are equipped when it comes to the available beds, ventilators, as well as medical personnel. Now, this modeling has also indicated that what will be required to increase capacity to meet a number of surge scenarios. And we are poised, prepared, and funded to procure and allocate these resources in short order. To do so, Health Services Authority has continued to procure additional staff by partnering with nurses, physicians in the private practice on island, and partnering with other government entities to provide staff for additional temporary administrative roles. My ministry will continue to work alongside public health, the medical sector, the Civil Services Program Board, and a wide range of stakeholders to ensure that we will have surge capacity to monitor, test, and manage the demands of the most likely scenarios. As part of an ongoing collaboration with the private sector, Public Health will begin making presentations to the business community on the 28th of this month. Now, these sessions will aim to ensure that the large and small business owners are clear on the necessary preparedness measures to assist us to move into the next phases of reopening our borders as safely as possible. Now, of course, the arrival of the lateral flow testing, also known as rapid antigen testing, has proven to be a real game changer within the last week. Our critical preparedness and readiness plan will use these lateral flow testing as part of the layered approach to manage COVID-19, including other safety measures such as vaccinations, mask wearing, and social distancing. I must state that the potential of such testing to reduce the impact of COVID-19 in schools and on our islands has become clear. As the number of people on island increases, it will become even more central to our living, or us being able to live and manage COVID-19. For example, we know that 3 out of 220 individuals who were tested positive in the very first lateral flow pilot testing on Saturday. Now, what that meant is that 62 families taking part, where 59 were able to immediately leave quarantine, while 9 persons out of 216 participating in this test tested positive. In the second pilot, this still meant that a further of 55 families could leave quarantine right away and get back to their lives. This is the benefit of us introducing and using lateral flow testing in our community. And I am quite sure for all of those persons who took part of that pilot, understanding what comes with quarantining and isolation, it was definitely a breath of fresh air. Now, the Ministry of Education, a key partner for the public health team, is in the process of implementing a national lateral flow testing policy for education. And this is to ensure the safety and continuation of learning at our schools. However, I am pleased to also report that the Ministry of Health and Wellness has today made available to the Ministry of Education an additional supply of 20,000 tests for all schools for the commencement of lateral flow testing. All of these tests that we will be distributing will be free of charge, and much more information is forthcoming from the government as rolling these lateral flows out within our communities amongst ourselves in the coming days. Now, I can tell you that the layered COVID-19 prevention protocols deployed throughout the education system will happen in tandem with contact tracing, isolation, and quarantine where needed, and this will be managed by Public Health Department. Parents and students alike have commented on the ease and comfort of using lateral flow tests. The instructions are very clear and simple, and the demonstrations during the pilot were well received. Even the children, I can't believe this, they were actually enthusiastic. They were pretty excited at how simple and easy it has been. I would like to congratulate the Public Health Department on their continued hard work and job well done with their implementation of the pilot programs and the education of participants on how to use the tests. You may recall the middle of this week the public health team are managing the households that need these quarantines, and we have seen the positive results from that. Now, the ability for individuals who suspect that they may have been exposed to a positive case to quickly self-administer an accurate test before interacting with others is in fact life-saving. And taking this process one step further and engaging in routine surveillance testing for both vaccinated and unvaccinated residents, even if they're asymptomatic, is an important part and toolbox to protect the vulnerable amongst us. With regard to this kind of testing, I think it is simple to remind the public that in accordance with Section 19 of the Public Health Act, 2002 revision, COVID-19 is a notifiable disease and persons are obligated to report their status. Let me say, an ounce of prevention is worth a pound of cure. As such, I would urge you to continue to follow the COVID-19 prevention protocols of mask wearing, social distancing, and hand washing. And yes, I'm going to say it. Please go and get vaccinated if you haven't yet done so. We have also opened up a booster program, as alluded here, for age 50 and over to healthcare workers and extremely vulnerable. Visit hsa.ky for the most updated details of these clinic times. I would strongly urge everyone who is still unsure but who are eligible to receive the vaccine to please go ahead and talk to your trusted healthcare provider about the risk and benefits of your personal situation and consider taking the vaccine. Please help to protect those vulnerable ones amongst us who cannot take the vaccine. Your government has invested a lot in getting these lateral flows in, and we are giving them away free of charge. Vaccines are also free of charge. Finally, I would like to end my message to you today by thanking the Ministry of Health and Wellness, the civil servants for all of the other ministries and public health teams for everything that they continue to do every day to keep our community safe. And if this does not represent, look at your panel here today, unity, unifying the civil servants and your elected official, because it's all keeping us, Cayman, safe. Thank you.
Thank you very much, Minister for Health, Honourable Sabrina Turner. So now as we mentioned earlier on, we are observing appropriate social distancing here on the panel. So we are going to be inviting the Minister for Tourism up shortly, the Honourable Kenneth Bryan, and so there will be a little bit of a maneuver going on. I'm going to invite Minister Bryan, how are you doing, sir, to step up. I will just add that I also got my booster shot today, so a lot of people seem to have got their booster, and I'm feeling pretty good. I hope you're all feeling good who got your shot as well, so just gives a little bit more confidence. But thank you very much. So we're going to turn now immediately to the Minister for Tourism.
Thank you, Simon. Good afternoon, panel. Yes. Good afternoon, everyone. As you heard, the Honourable Premier said within a few weeks, the Cayman Islands will move into Phase 4 of the reopening plan, and the quarantine restrictions will be removed for all fully vaccinated travelers arriving to our shores. I know there's many of you out there who are jumping in your seats. I am too, you just can't see it. From November the 20th, after showing proof of vaccination and a negative PCR test taken within the 72 hours of arrival, visitors will be allowed to head straight to their hotels to begin enjoying all that the Cayman Islands vacations have to offer. It's been a long and challenging year and a half since we've been able to receive leisure travelers. With the reopening date now announced, the Ministry, the Department of Tourism, and private sectors will continue to work closely together to fine-tune the preparations to safely welcome visitors and greet them with our infamous and famous Cayman kind hospitality. The goal of the phase reopening is not just to safely reopening our borders, but to keep them open. The slow and steady approach undertaken thus far has been the hallmark of how Cayman Islands have handled the pandemic. Taking the necessary steps to consult and collaborate has allowed us to review the lessons learned from other countries and incorporate the best practices, protocols for keeping residents and visitors safe while reintroducing tourism to our destination. Earlier this week, the Department of Tourism hosted focus groups, and further meetings are planned with the industry stakeholders to dive deeper into scenario planning and to gather feedback for further rounding out our tourism preparedness strategy. All of this heightened the government's and the tourism industry's capacity to manage the risk associated with the quarantine-free travel. And indications from our tourism partners signifies that they are ready and waiting to welcome tourists back to our shores. But in order for visitors to return, international airline service has to be in place, and there's good news to share with you in that regard today. This past Saturday, October 16th, was a significant day for the Cayman Islands, which was marked by the return of commercial flights between the Cayman Islands and 2 U.S. gateways. JetBlue resumed its service from JFK, New York, earning recognition as the first U.S.-based airline to return to the Cayman Islands since the closing of our borders in March of 2020. The return of the New York service, which traditionally is our best-performing U.S. gateway, marked a significant step forward in the government's effort to rekindle tourism in the new normal travel environment. Airlines are strategic partners that play an important role in our ability to rebuild the industry because they make the Cayman Islands accessible to the rest of the world. As the service from JFK has only just returned, passenger loads are expected to be low initially and will gradually increase as the service becomes more reestablished and the public confidence rebuilds. JetBlue are operating 2 flights a week on Saturdays and Tuesdays, demonstrating tremendous commitment to the Cayman Islands, and I thank them so much. And I sincerely want to ask the rest of the industry to maybe do the same. On Saturday, the Cayman Airways also relaunched their weekly nonstop service between Grand Cayman and Tampa, Florida. The Tampa service is a popular route for visitors as well as local residents and gives travelers the options to getting to Cayman from 2 convenient locations in Florida. The return of these flights has started the ball rolling to grow stayover arrivals from the U.S. and signifies a great show of support for our destination. I'd also like to take this opportunity to say that we look forward to the welcoming Air Canada service from Toronto, which is due to begin on December 4th. So that's just 14 days after our official reopening. And Air Canada, if you want to bring your schedule a little bit earlier, I'm totally cool with that. I'm advised that anyone wishing to travel on Air Canada can book their reservations directly online now. The return of Air Canada means that there are now 4 airlines with confirmed routes to the Cayman Islands, namely British Airways, JetBlue, Air Canada, and Cayman Airways. I thank these airlines for their confidence that they are showing in the government's reopening strategy, and I hope that following today's announcement, the other international carriers will consider bringing all their return dates forward in line with the government's commitment to reopening. While I was at the airport on Saturday for the arrival of JetBlue, it was clearly evident that the airport facility and staff are ready to welcome tourists back. The airport was spotless and offers a safe environment to manage the flow of travelers from arrivals through to customs and border control and on to the public transport providers. The process is efficient and effective, and as currently stands, the taxi drivers who transport passengers from the airport decontaminate their vehicles at a station located at the perimeter of the airport. As a part of the preparations for handling the increased volume of travelers, the ministry is looking into other options that will give the public transport operators the ability to manage the sanitation process themselves, such as using electrostatic spray to decontaminate their vehicles. This process is in effect in other jurisdictions and by all accounts is working very well. I am hopeful that the decentralizing the process will encourage more taxi drivers and transport operators to return to service, providing transport to returning visitors. Right now, the government is managing and meeting the cost of the vehicle decontamination process, but as passenger numbers increase, having decentralized decontamination stations will become a bottleneck. My view is that the process should be transitioned to the transport operators and taxi drivers. Self-sanitizing will enable a faster, more efficient operation and will allow drivers to make more trips and increase their earnings. Options are still being explored and further updates will be provided to keep the public and the transport operators informed once the new process has been finalized. The park administration, tourism stakeholders, private sector businesses, and the wider public are all in agreement that the priority when it comes to reopening is to use the best procedures possible to keep residents and visitors safe while reintroducing tourism into our destination. Since I became Minister of Tourism, I've met with many operators and I've seen the competency, passion, and professionalism within the industry. Many tourism-based businesses and accommodations have already begun practicing safety protocols because the reality is, until COVID moves on from a pandemic to an endemic like the common cold, or disappears altogether like smallpox, the way that we once went about our lives have changed. Whether that's eating out, visiting gyms, spas, or going to the cinema, taking public transport, COVID awareness is now at the forefront of activity and interaction. Consequently, staff are being trained, mask mandates are in effect, and I understand that the vaccination levels within the industry are very, very high and will be an ongoing monitoring from managers in the industry and testing throughout public health. This is the new reality of living with COVID. Aside from this, and perhaps more importantly, welcoming visitors back means that people can get back to work. Number one priority. As a part of the national training program, the Department of Tourism has hosted several training opportunities to help people upgrade their skills and re-enter into the workforce. I'm very excited to share the news that 2 new training programs will be offered in November. You may have, as long as you're over the age of 18, that is. The courses are the Shaker International Bartenders course and the Front of House Servers course, which is taught by the Wine School 3. These are internationally accredited courses that are sponsored in part by the Department of Tourism and are being offered free of charge to the participants. Even the bartending kits will be provided at no cost. I encourage anyone, especially those in the displaced tourism workers, who either wish to launch a career or develop their skills in the beverage and hospitality industry, to please register. More details about these courses and how to sign up will be released next week, so look out for more information at the Department of Tourism website. Before wrapping up, I would like to provide an update as to the DMS $100,000 vaccine raffle. I know everybody wants to know about that. I've been informed by DMS that the selection, verification, and administrative process is now underway, and a winner will be announced on November the 22nd. Again, the winner will be announced on November 22nd. Too bad it can't be me. The process for finding the single prize winner involves verification of being fully vaccinated by HSA, the random selection of a name, and verification of Caymanian, permanent or legally resident status in the Cayman Islands. Persons who have submitted a refer a friend into the drop box at the HSA clinic received an additional entry into the drawing for each referred submission. To date, DMS have already awarded over 20,000 CI dollars in cash as a random spot prizes for vaccinated recipients and referrers in support of the government's vaccinations goals. I can't thank them enough. Ladies and gentlemen, while there are a number of other initiatives happening within the Ministry of Tourism and the Department of Tourism, as well as exciting marketing that is being led by DOT, that I would love to update the public on as time is of the essence, I will leave it there in terms of updates for this briefing. I will provide those updates in future forums, as I expect the media is patiently waiting for the opportunity to ask some questions. I know that our tourism partners and workers in the industry will be pleased to have a reopening date today, and I thank them and the wider public for their patience in understanding while we journey through this point. Thank you.
Thank you very much, Minister for Tourism, the Honourable Kenneth Bryan. So yes, as we now transition to our period of questions to the media, we're going to keep it fairly tight and lean and just probably go with 2 questions each. I realize and we value the media very much. It's an important component of democracy, but I think we'll begin now with Cayman Mall Road, if you're standing by and ready for a question. I will just add that Minister Turner will be returning to the podium if you have a question there. We'll probably keep Honourable Kenneth Bryan sitting at the actual the main podium here. So are you ready, Cayman Mall Road, or should we go with Miss April Cummings? I'm gonna try to maybe unmic you, ask to unmute, see if that helps. So obviously a lot of change.
Yeah. Sorry, Simon.
There we go. Yep, we can hear you now. Thank you very much.
Okay,
So-
wonderful. Thank you so much. Of course, people are still asking. Apologies for the feedback, but people are.
We're losing you a little bit there, Ms. Sandra. You're sort of cutting in and out a little bit.
Right. So, Simon, people are still asking a lot of questions as it relates to vaccinated persons traveling with children. So that seems to be the number one question that is flowing out of what we heard today.
Who would you like to direct the question to? We have the Medical Officer for Health, Mr. Samuel Williams Rodriguez, and Dr. John Lee, or we can send straight to the panel.
I think that the question is probably best directed at one of the health officials, so maybe Mr. Rodriguez.
Okay. Well, while he's coming up, I think the Premier, would you want to make a little comment as Mr. Rodriguez makes his way?
Health official, so maybe Mr. Rodriguez.
Yes, sorry, Sandra. I think this is obviously it is a question that the health authorities could provide input on, but it is also a question for us to consider on the government side. We in our discussions last night with the private sector, which as I said earlier, I thank them very much for their participation, and we welcome all the comments we received, and we were seriously considering those. One of those questions did center on the ability for unvaccinated children to be able to come in. Our original plan basically consisted in phase 4 of not having any children who could not be vaccinated. Phase 5 did provide for vaccinated parents with children. We did consider whether to sort of do a hybrid and fuse that element of phase 5 with phase 4. The advice at the moment, and for everything that we have considered, really centers around the level of risk that currently exists and how we balance that to ensure that we don't create a situation where we end up with too much community transmission going on. We would love to be able to accommodate children coming with parents who are vaccinated and the children are unvaccinated. But the reality is we think at the moment it is very difficult for us to ensure that we have that balance right. And so we're keeping that under consideration, but it is not a decision that we have made at this point.
Thank you very much for that response. I don't know whether you have a follow-up question to that, or would you like to ask another question, or just hand it over to somebody else? I've actually muted you again, Sandra, so you'd have to, I think, there you are.
Yes, Simon, there's just one other question.
Right.
And the second question really relates to the verification of vaccinated individuals. There are a number of concerns now about how do we verify anyone who claims that they're vaccinated? And if the government will be looking at increasing in any way the penalties for someone who produces any sort of a fake vaccination record. And just another addition to that, someone is specifically asking if persons who were CDC vaccinated, if they would be eligible for to be considered vaccinated. So I think when they said CDC, they may have actually been part of a trial. So the specific question was whether or not those individuals would be considered fully vaccinated for the purposes of entry.
Thank you very much. I'm not certain exactly who that would be directed to, but does anyone wish to field that
I
one?
think either myself or the Deputy Governor. I'll take a shot at it initially and then allow the Deputy Governor to fill in any gaps, perhaps. I think in relation to the new approach, we will have both the electronically verifiable confirmation of vaccinations, which is the QR code, and we will also have a portal through which you can upload your vaccination documentation, and CBC, our local CBC, Customs and Border Control, will be able to review the submitted documentation, and they will be issuing an approved travel certificate if they're satisfied. And they are obviously experienced in looking at this, and it will, I think, in the case specifically of the question around some CDC participation, or I think maybe Sandra was referring to perhaps some sort of trial type thing. I think those types of things can and should be able to be verified, as well as the typical vaccination records through health providers, our health service providers. So I think we will be able to do that, and I think those systems will work side by side. And invite the Deputy Governor to fill in any gaps, as I said. 60%. Oh yeah, sorry. Thank you. That there is a limit in terms of the vaccination record for each country. So countries that have a vaccination record which is 60% or higher, vaccination attainment which is 60% or higher, those countries we will be accepting the verification through the portal. For countries where the vaccination record is less than 60%, we will still be accepting secure verification if they have that, and they will be treated in the same way and get that accepted as secure verification without having to do any kind of quarantine.
That's correct.
Yep.
Do you wish to add anything, Deputy Governor? Or
Premier is spot on. Yeah.
you got it all?
Yeah.
Okay. Great. Thank you for those questions, Sandra. I think we're going to go straight to April Cummings now, if that's okay, April.
Thank you very much, Simon. Can you hear me okay?
Yeah, loud and clear.
Okay, great.
Good to see you.
So I will squeeze my 5 questions into 2 for help matters.
Doubling them up.
The first is really, essentially, are we still following the phase 4 as outlined on the exploregov.ky website, or is there anything that is different than what I'm still seeing up there today? I think that's really the primary one for me, because people have a lot of questions about the details.
There's an awful lot of material on that website.
I'll let Deputy Governor.
Deputy Governor's going to pick that one up.
Thank you, sir.
Thank you, April. What the Premier published, or what the government published a few months ago, is largely what we're following now in terms of the very high level, except what the Premier said just now in terms of us allowing persons that we cannot securely verify their vaccination certificates electronically, if we can verify them by other means, we're then allowing them to come along with a 60% proviso. But largely everything else is the same. What we're doing now, as I stated earlier, and the government has charged us, is not just to produce the high-level plan, but then to drill down. So what we didn't publish earlier was how we're going to do a lot of the things that need to be done to keep our people safe. So that's what we are finalizing now, along with our private sector partners.
And Deputy Governor, I'm not sure this is your question, but it could be. What will it take for us to get from where we are to phase 5? Because I already have my phone blowing up with people asking, how do we get to the next part?
If I can add a little bit of context to things, I think the fundamental difference between phase 4 and phase 5 is those important, wonderful children. And as you heard the Honorable Premier say, we're considering how best to do that safely, as we need an opportunity to assess the circumstances and how we're doing in the first phase. Now, obviously, there's reasons why we do it in phases in a certain amount of time, so we can not make everything at once, just in case we need to pull back or readjust things. So we understand, particularly the Ministry of Tourism and the Department of Tourism, that many stakeholders are concerned about the opportunity to bring their family. This is a family destination, as well as Caymanians who have their loved ones overseas who may not be old enough to be vaccinated. So even though the decision had to move forward to the phase 5 quickly, we're definitely looking at ways to make it done safely, where the lateral flow can assist with that. But until we're certain of safety component has been covered, we can't move to that stage yet. So, but more details will come in the future. We just want the public to know that we recognize the problem that it creates for some people.
And I know this is a third question, but this is really a confidence question. One of the concerns I've heard from folks, it has had to do with people who are just nervous about making any decisions right now in case we change our minds and backtrack. What can you say to those folks? Is this a valid concern? How can you reassure them that it's okay to spend money, buy an airline ticket, just make plans?
I'm going to let you speak first. I will add anything I think I need to.
I think that the recent outbreak has given us a lot of things to learn from. I've actually heard the term, it was a blessing in disguise for it to happen when it did, rather than happening on the October 14th, where we would have had to learn some hard lessons while tourists were already here. I feel confident as Minister of Tourism, and my responsibility is to try to get passengers here so our industry can flourish and get our people back to work. I feel confident that my colleagues and everybody in the room feel strong about what the program board and the civil servants have been doing. I mean, they've been excellent over the last 2 weeks, and all the signals give me comfort to know that we're going to be prepared for when we're open, and that we're doing it in such a measured way that we should never be overwhelmed to cause us to shut down. So therefore, that should give the industry and business deciders enough confidence to say, listen, we do not want to go back. That's why we took so long to do it in the first place. So that cautious approach is the part that you can be confident with, that when we do open, we're going to stay open.
Thank you for both those questions, April. Just as a follow-on, I think you triggered a question in my mind as well, April. And I was wondering whether Dr. Lee would like to talk a little bit about the sort of timelines possibly, and the likelihood of the vaccines being rolled out to younger people in the population, and how that might even impact the decisions in terms of travel and so on.
Thanks, Simon. I think it's a really exciting area because a lot of people are looking forward to being able to vaccinate their children. It's a really, also at the same time, it's a difficult area because it's very much, I feel, one for parental consent in many cases, and in some cases a joint decision between children and parents, and for them to make alone. We've seen that the children younger than 12, between 5 and 12, are the trials have been done, but we're still waiting for one of what we call the stringent regulatory authorities to approve those vaccinations. And I think once one of them does, the others will probably all end up falling in line because they will have seen the data and they'll be satisfied that the data means that they're happy to move forward to vaccinate that group of children. You've probably also seen that some of the other vaccines are also coming online at smaller doses and have been successful, both Moderna and I think it was Janssen at smaller doses for the younger children. So it's good news. It's around the corner. It will be coming soon, and a lot of people will be very pleased for it as they can keep their children safe. And in a particular group, really, the children who are likely to suffer very badly should they get COVID. And I know that the parents are particularly concerned about that group of children.
Thanks for that response, Dr. Lee. So we're going to move right along, and thanks very much for your questions, April. They were very good questions. Can we also now go to Ms. Wendy Ledger and from Cayman News Service and ask Wendy to ask her question.
Hi, Simon.
Hey.
Hi, Simon. Thank you. I'm going to try my best now to try and make my 16 questions about testing into one for Dr. Lee. So whilst he's maybe coming up to the podium, I want to ask him about how the rapid testing results are being reported and how that's going in the pilot and how it will be reported going forward, i.e. the results, how are the parents phoning in with their results, how it's all being managed. And also in a sort of the bundle question, where is the rapid testing policy so that everybody else can start using them?
This is very much a work in progress, Wendy, and we've been burning the midnight oil to try to finalize the details. And they are nearly finalized, even up to the last minute before we appeared here. We have been working on it and working on it very hard. It's something that we want to get right. We want to get it right first time. We don't want to present a job that's half done. And that's why we have not brought forward something to give you the exact detail today. The reporting mechanism is one that we're particularly interested in. I think actually probably in a few weeks' time we'll have a different mechanism than we have now because we'll be able to develop electronic solutions to that and increasingly sophisticated electronic solutions, and whether eventually we'll be able to link it to the hospital record as some countries do, that would be a great thing to achieve. But at the moment, what we're really interested in is the positives. And as you know, because this is a communicable disease, and as Honourable Minister Turner has explained, that is, anybody in the community needs to report that to the Medical Officer of Health. It's a legal requirement to do so. So we want to know about the positives immediately. Public Health wants to know about that. And we recognise that the mechanisms for sharing that information must be very clear and very obvious when we roll this programme out. If somebody is positive, we will then focus on that household and monitor that household particularly closely, as we now do. So Public Health will continue to do that close monitoring for that household until they're satisfied that that close watching will no longer be required. As far as, for example, a school or a large institution like the government administration building, we are anticipating that those sorts of organizations would report in aggregate the total number of tests that are being done, so that we can see what percentage of those people attending are being tested and then get a feel for what the level is across the country. I'm sorry I don't have the finer detail to share with you today.
Okay, can I just clarify that during the test pilot that's been going on this week, have you been able to, are you confident that you've been able to, people have reported back as they should be reporting back? Have they been complying with the test?
Well, they're contacted on a daily basis, so it's, I mean,
right.
So we have that communication level. It's the same as if you're calling in to a family and finding out about symptoms. If somebody is positive, whether you've had a temperature, a cough, and so on and so forth. So I absolutely take the point that it is possible that some people would not report back what has actually happened.
Right.
It is really incumbent upon the population to understand that we are trusting people. Just as we ask them to come forward if they have symptoms, to come forward to the flu clinic to get tested for PCR testing.
Right.
the success of business continuity, our ability to keep schools open, our ability to keep our jobs going, absolutely depends on us trusting the public to use this to the benefit of the whole community and to correctly report if they're positive and to come forward. I know it's an inconvenience, but it's absolutely essential, because without that, the schools will begin to close. Businesses will no longer be able to continue. It's absolutely vital that we get this right, and we really do hope and trust that the public will help us in this regard.
So as of Monday, when the kids go back to school...
Can we just jump in? We're going to have just one more question for you. I think it's a
Simon,
it's a very important question. It's a critical question, and I think obviously it's very important people
I think
are aware
everybody wants to know what's going to happen on
Yeah.
Monday with the schools and whether kids are going to be able to go back to school.
That's fair enough. I think it's a reasonable question. So we'll just...
Because it's Monday, and are they going to be able to go back to school and use the rapid testing so that the only children that have to isolate are the children that are positive and not their negative classmates?
Honourable Premier.
Wendy, can you hear me?
Yes.
Right. So the Education Ministry have a very detailed plan, and they will be rolling those out over the course of I think perhaps Sunday and Monday, to get those out in the schools, to have them delivered to parents. We don't have the chief officer here at the moment, unfortunately, who could provide a lot more detail around that. But they have a very clear plan. They've thought this through very well, and the intention, yes, is to have those lateral flow tests available to the schools to be delivered to parents on Monday, at the latest on Monday.
And yes, kids will be able to get to school on Monday.
Okay, because this is what everybody wants to know is at the moment, the rules are that if 2 kids test positive in a class, the whole class has to, and their families all have to go into quarantine. So are we now on Monday saying, no, it will only be the children that test positive and that's it? Everybody else gets to go back to school, to stay in school, I should say.
Yes, essentially. So that's the whole benefit of the lateral flows, because at the moment, if you're able to do really a lot of testing, then you can work on real-time data. And it's essentially like, for many diseases, if you get a temperature, you know you're sick. So for MERS and SARS, if you get a temperature, you know they're sick. But unfortunately, with this particular one, you can be asymptomatic and be carrying and spreading the disease. But now we've got the lateral flows, we can do regular testing in the schools, and if there is a positive, even more regular, move to daily instead of twice weekly testing, and only isolate the people who are actually positive rather than the whole class, so that we can keep that class and schooling going.
Great. Thanks very much for your questions there. When are we going to move right along? But we do actually have a question from a listener who was wondering about staffing resources at Department of Tourism or Travel Cayman for monitoring and coordinating the enforcement, testing, isolating, sanitizing, etc. for the tourism industry. So staff resources at Department of Tourism or Travel Cayman. And I don't think we have Ms. Cassandra Morris here, but is...
Are you speaking, let me see if I can understand the question properly, but enforcement of the industry itself?
I guess earlier the Premier mentioned, actually the Deputy Governor mentioned that, hotels might be expected to set aside rooms and things like that,
Correct.
Anticipating that they're going to have positive cases appearing. I think this question may be asking, are there additional resources in the wings to sort of...
Simon, I think in early stages, the top priority today is the opening date, who can come, and what the protocols would be in order for them to get here. On behalf of the Ministry and Department of Tourism, we're going through an extensive consultation process with industry. We've met with them a couple of times now and ironing out all of these minor things. We're pretty much 90% there, but want to make sure that when we actually say every detail about what's going to happen in the industry, from cleaning, from expectations, what happens with a person if they're positive in the industry, how many expected rooms have to be set aside for persons in isolation within the industry. Those kinds of things are pretty much almost done now, and we expect to have further updates at further press conferences so the industry can be clear about that. But I'm happy to say that CETA is right in the midst of these discussions, who represents the industry, and will trickle down that information so they can be aware as well. But the most important thing is the comfort for listing visitors to know that all of those things will be in place, so when you get off the plane and you go to the hotel, you'll be safe.
Thanks for that. Okay, so I believe we got Ms. Reshma Reganuth standing by from the Cayman campus. Reshma?
Good afternoon. Thank you, Simon. I have a couple of questions. I'll start first with the portal that the Premier mentioned and the limit for the countries. Does that exclude the US, given the fact that they have 50% vaccination? And are you referring to full vaccination or first dose only?
First dose only. I see that my phone almost rang off the hook as well, because all the industry leaders are worried about it. So places like Canada, United States that are past their first dose, past 60%, the figure we're talking about is not 2 doses, but first doses. And in respect to Johnson & Johnson, where I think it's only 1 dose, single dose, they will also be recognized, obviously.
Okay, thank you for that, Minister Bryan. As you're on the mic, in terms of the management of the tourists that are coming in and the vaccination, are you going to be allowing those with, say, mixed doses, given the situation in Canada where you have the AstraZeneca and then some people taking the Pfizer because of the limited supplies? How does that factor into the plans?
I think that's a question for Dr. Lee, but I think we've discussed that already, so you should have a fluid answer for you.
Okay.
Thanks, Reshma. I mean, a lot of countries are mixing and matching, and a lot of studies actually show that mixing and matching is good. So we don't have a problem with that. We have the UK Health Security Agency has given us a very useful document showing all sorts of different combinations and how to improve vaccination should you need to, and all sorts of combinations that work. But there's no problem there.
Okay, great. Thanks, Doctor. I do have some questions for you, and I know I have a limit, Simon, sorry, but I need to get this out. Dr. Lee, in terms of the cases that you've shared, and yesterday you made a very important statement in your video message about people coming to the flu clinics and going to their private healthcare providers testing positive for COVID-19. How are the health services going to be managing their ramping up of their operations as we prepare to welcome visitors while we have an outbreak basically that we're dealing with now in the community versus the clusters that we had in schools?
I think that sort of goes back to the response plan that the Deputy Governor was talking about, Reshma. We're certainly not being overwhelmed by the numbers of people that are attending. We have not actually seen that much influenza at the minute. We're seeing COVID instead. We would probably be seeing influenza now. So that is part of the response plan that we're building in and the action plan as a result. I think also we haven't needed to tap into the huge resource we have in the private sector for dealing with people with more minor ailments. There's a lot of spare capacity out there, and I don't feel currently that we're being overwhelmed.
Well, thank you very much for that response, Dr. Lee. I think we're going to begin to wrap it up. We really appreciate you taking the time to tune in. I don't know whether there are any final comments from the panel at this stage, or whether we'll thank our viewers for their time and their attention. And
Simon, could I just ask? There's been lots of work done around assisting public health, managing the persons in the community, and as was the question just asked, what are we doing to assist public health in this time? And we have Dana here from Hazard Management, and I would just like her to just spend 2 minutes just updating the public as to what the work that her and her team has been doing to assist public health.
Thank you very much, DG. Yes, there has been a lot of work done, obviously, behind the scenes in regards to assisting people who need it. The humanitarian needs are obviously very critical at this time. So we appreciate that the flu hotline has been somewhat overwhelmed over the last few weeks, and people who need food supplies, who are isolated, obviously need that assistance. So as of Monday morning, we will set up an independent isolation hotline, a support line, as well as an email address, and have call takers in there to assist you. Just by way of example, again, the email itself is isolationsupport@gov.ky, and the phone number is 946 3530, and we'll have a toll-free number as well of 1-800-534-3530. And again, this is for humanitarian needs, food supplies. We're working very closely with the Red Cross to deliver those, but again, there'll be a needs assessment to make sure the right people are getting the food required. And then we're here to help, again, to make sure that the government is supporting those who need it most. Thank you, DG.
And Simon, just to say, I think that's a really great example of what I spoke of earlier, where we have this amazing joined-up approach between the public sector, the private sector, our NGOs, the Red Cross coming to work with us, our amazing volunteers from the community, everyone working together to meet the needs of our people. The Premier phone was ringing way too much. His phone, Minister Bryan, all our ministers were getting calls from their constituents. I have no food, and it was very important for us people in community isolation, it was very important for us to meet their needs. And I'm very happy to see that we have made this progress to be able to address that real concern in our community.
Thank you very much, Deputy Governor. And yes, it's been an entire country-wide approach to this pandemic. And I recognize that the journalists out there probably are adjusting to not probably the press conferences going on quite as long, but I think it may be better just to tighten it up a little bit. So that was the approach tonight. And if you do have questions, please submit them to GIS, Government Information Services. We'll do our best to follow up and answer any questions you have. And just want to thank everybody on the panel. Minister Bryan is going to have a comment before we
I'm almost certain that the Premier was...
Well, I just wanted to say very briefly, thank you. You're right, we have recognized that the press conferences have gone on too long, so I'm not going to belabor it and take any significant amount of time. But I wanted to thank everyone, thank the Deputy Governor for participating, thank all my colleagues for all of their contributions, and the members of the media for their great questions. I know there are lots more questions, as you have noted, but I want people to understand, as the Deputy Governor has said, that there's a lot of work going on. We will be engaging further with the private sector. We will be making sure that all the great plans that we have, the very deep and detailed plans, gel and fit in nicely on the operational side. The Minister has noted the amount of work that his ministry is doing with the tourism stakeholders to achieve that sort of thing as well. And there will be an ongoing communication process in the coming days and weeks so that people understand exactly what the full plan looks like and they get more and more information. For us to have a press conference to go into great detail about the plan today would have been 4 or 5 hours. We're trying to go the opposite direction. We're trying to respect people's time. So thank you, and I'll turn it over to my colleague who want to have a couple of words.
Thank you, Premier. I think you stole half of what I was going to say, so it's okay. I just want to just confirm that, it is November the 20th is the new date moving forward. I know that there's a lot of persons overseas who are watching the program. The Ministry of Tourism will be working with the airlines to ensure that we try to get those airlines up a little bit, schedules up a little bit more. So airlines, you'll be receiving some notification from my ministry in short order, so you can get that confirmation back up to the biggest boss in the airline to bring those lines forward. I want to take this last opportunity to say, though, that this administration is moving forward with confidence. And the Cayman Islands have been blessed for many, 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 many decades, many hundreds of years. And the reason for that is our faith in God. So I ask those prayer warriors out there, I know it's not a big fan thing for everybody, but I'm a believer. And I ask that you pray for us, all right? We're going through uncharted times, and some prayers would definitely help us through this. So with that being said, thank you so much. God bless you and have a wonderful day.
Thank you very much, Minister Bryan, and also from the Premier. And
Simon,
again-
could I just do one last thing?
Yes, sir.
It would be remiss of me not to thank so many people within the civil service and wider public service. The Premier and the Minister has heaped a lot of praise on the civil service and public service, and rightly so. But I do want to sincerely thank all the people in the program board, Ms. Rodriguez and her team down in SRIU, the cabinet office led by our cabinet secretary. They have been doing some amazing work, working together. The wider civil service, the wider public service, all members of the program board for all of the work that they're doing. And a big thank you to the private sector for also engaging with us, giving us the criticisms, but also telling us when we get it right, and we want that engagement to continue. So thank you very much.
Thank you very much, Deputy Governor. And thank you to all our viewers. Thank you to our journalists too. And we do recognize the importance of your questions. We value them, and we're not trying to be unreasonable, but I do think it needs to be, an hour and a half long press conference is quite a long thing. So we are trying to get it to be a bit more streamlined. But certainly if you have questions, please forward them, and we'll be happy to do our best to answer them. But we wish all our residents a very good weekend, and thank you for tuning in, and we will see you again soon. Good night, everyone.